Good evening and welcome. My name is Chimere and I would like to take the time to enlighten you about schizophrenia and its effects. Believe it or not, it affects more than 2.5 million Americans. Many people seem to think that schizophrenia is the same as multiple personality disorders, but their assumption is wrong. Multiple personality disorder is different and it affects less people than schizophrenia. People with schizophrenia do not have split personalities, rather they are split off from reality. The word schizophrenia is derived from the Greek word schizo and phreno, meaning shattered mind. Schizophrenia is a brain disorder that affects the way a person acts, the way they think, the way they see the world around them. People with schizophrenia have an altered perception of reality, which often causes a significant loss in the way they view the world. They may see or hear things that do not exist. They speak in strange and confusing ways. They believe that others are trying to hurt them and that they are being watched constantly. With such a blurred line between real and reality, schizophrenia makes it difficult for those to navigate through daily life. So in that, they withdraw from the world in fear and confusion. A few common signs of schizophrenia are they are delusional, they hallucinate, they withdraw socially from the world, they're forgetful, and they're unable to concentrate. They have disorganized speech and behavior. With these warning signs, although they are present in other diseases, schizophrenia is not just the cause of that, and if it causes concern, medical attention should be sought. When a person acts out of behavior and presents a problem with performing daily tasks in order to get along throughout the day, they need to make sure that they are treated properly. When the signs and symptoms with schizophrenia, they are very drastic in their pattern as well as their severity. And people with schizophrenia do not all have the same symptoms. They constantly are changing over time. There are three types of schizophrenia, well, three subtypes of schizophrenia, and that is paranoid schizophrenia, disorganized schizophrenia, and catatonic schizophrenia. Paranoid schizophrenia is when a person believes that someone is out to get them, cause them harm, out to persecute them, basically. They with disorganized schizophrenia, a person sometimes does strange and silly things, and their behavior and emotions are inappropriate. Their speech patterns are bungled, and that usually happens in those who are younger, in a sense. Schizophrenia affects males earlier on than it does women, but it does affect each gender equally. With disorganized schizophrenia, people usually resort to their own fantasy world or their own source of reality. With catatonic schizophrenia, it affects the movement of a person. Their motor activities are either increased or decreased, such as in paranormal activity. When the lead woman was standing over her husband's bed, she stood there for hours. That is somewhat of a form of catatonic schizophrenia. The causes of schizophrenia are not fully known, but it appears that they result from some type of interaction between genetics and environmental factors. Schizophrenia has a strong hereditary component, and individuals whose parents, siblings may have it, they have a 10% chance of developing that disorder opposed to the 1% of the general population. According to Discovery Health, it said that genetics account for about 80% of the risk for schizophrenia. Although schizophrenia is not influenced by genetics, although schizophrenia is influenced by genetics, it's not determined by genetics. Another factor as far as the environmental is stress. It says that the more they do research, they find out that stress from either pregnancy or later stages of development causes a risk for schizophrenia because of the high levels of stress. It believes that it triggers the schizophrenia by increasing the body's production of the hormone cortisol. Michael Foster Green, who is a medical doctor, he states that there's evidence of chemical imbalances in certain neurotransmitters, proteins, and amino acids that play a part in causing schizophrenia. When the signs of schizophrenia are signs of schizophrenia are ignored or treated improperly, the effects can be devastating to the individual who has schizophrenia as well as the people around them. Some possible effects of that schizophrenia is relationship problems, alcohol, drug abuse, disruption in their daily lives, as well as the increased risk of suicide. So the first step to schizophrenia treatment is getting a proper diagnosis, the proper and correct diagnosis, which is not always easy because a person with schizophrenia seems to think that there's nothing wrong with them. So it's hard for them to go to the doctor. And the best way to see if you have schizophrenia, if you know someone who has schizophrenia, the best thing to do is have them evaluated by a psychiatric doctor who has experience with identifying and treating schizophrenia rather than seeing a family doctor. A diagnosis of schizophrenia is not fully based on the physical examination or the medical history or physical exam or lab testing. With the lab testing, they do drawing blood and taking urine to rule out other health issues. But however, despite the widespread misconception that you can never be cured from schizophrenia, you have no chance of recovering with improvement, it's false. Because reality is there is a hope. Certainly, if you have a family base or friends that really care, that support system from that family makes a huge difference in the outlooks on patients who have schizophrenia. When a family member is involved in the treatment, patients with schizophrenia are more likely to avoid relapse and achieve a higher level of functioning. In conclusion, although schizophrenia is a disorder that affects over 2.5 million Americans, help is available. With support, medication, therapy, many people are able to function independently and live satisfying lives. So if you spot someone with schizophrenia or see signs or symptoms of schizophrenia, seek help without delay, especially if it's someone you really care about. Take the advantage of the treatments that they are in order to improve their chances of recovery. Thank you very, very much.